I run 10K now, but previously was a sprinter, so we'll try and get through this quickly. No conflicts. So, ischemic stroke has been reported after the use of synthetic cannabis, cathinones, carfentanil, synthetic hallucinogens. Okay, so a spread, in England we would call it many learnings to be had here. Screening drug tests utilize mass spectrometry, mass spectroscopy, gas chromatography, immunoassay. So this is how you write multiple choice questions. Okay, well, same here, learnings to be had. So we'll talk about what are designer drugs, we'll talk about synthetic cannabinoids, cathinones, synthetic hallucinogens to be specific, and synthetic opioids. Very briefly about synthetic opioids. So what are designer drugs? So these are synthetic analogs of controlled substances. So the idea is you have a controlled substance, you create a compound that is very similar to it, but can evade drug testing. So that's the whole theory behind designer drugs. You design it to have the effect you want, at the same time avoid it being detected. And they're intentionally marketed and distributed for recreational use. So this is usually the situation we end up with when we're dealing with designer drugs. Nobody knows what we're dealing with. It's like blind people trying to tell what this animal is, and the psychiatrist comes at it from one end, the emergency room physician from another end, lab medicine, well, they have no role to play because really they can't pick up anything on drug testing. So very briefly about urine drug testing. So usually you have the initial screening. The initial screening is either an immune or an enzyme assay, and this is using antibodies. So this detects a substance which looks like a chemical that the antibody reacts with. And if this is positive or negative, you can then run through what is called confirmatory testing. And confirmatory testing is actually very, very specific. You either use gas chromatography or mass spectrometry. And what they do is they break it down into the individual components and then very specifically identify the compound. So once you create a designer drug, one, it won't react with the antibody because it's sufficiently different. Two, because the compound is so unique, the mass spectrometry or gas chromatography also won't pick it up. So they evade pretty much all the tests that we have. You can create mass spectrometry or gas chromatography very specific to a designer drug, but they keep changing so quickly that you can't keep up with that. Synthetic cannabinoids. So this is